And when I click on that, it's going to take me out to my orders and charges portion of the chart. The screen that I have in front of me now simply is a representation of all the orders that have previously been signed onto this patient's chart. I want to get started with some new orders, however, so I'm going into the upper left hand corner and clicking plus add. So I have my diagnosis here from where I selected it in the note that we just demonstrated. So I'm going to select that diagnosis to pair up with the orders that I'm about to put in. I have to have a diagnosis for all orders before they're able to get signed, so that's why I had to complete that step. Now in my search box here, I can simply start searching for what I want based on keywords, or if I know the CPT code, I can simply type those in. So I'm going to type in for my office level visit and select that. Now you'll notice that my office visit is here under orders for signature, and all the order details for that order are on the lower portion of this screen right here. So I'm going to give this patient something to help with muscle spasms. So I'm going to choose the 5 milligram Flexeril. Notice here in the parentheses and in the gray text that I can choose a common order sentence already defined for this particular medication, basically a 10, 14, or 7-day regimen at 3 times a day. So I'm going to choose this item right here, the 10-day regimen, and you'll notice that I have a new pill bottle, meaning a new prescription. Down below, again, are all the order details. I'm going to choose the pharmacy here under the Send To option, so that's where I can elect to e-prescribe this particular medication. This medication is an acute med, not a maintenance med, so I don't want it to live on this patient's medication list forever, so I'll change to acute, and that will cause this medication to stop on this set date and time that I have right here. I'm also going to give this patient something for swelling, and even though we could get 800 over the counter, I'll go ahead and order that, and we're going to do a 10-day regimen, so I will change the number of tabs. In fact, I will just choose the number of days here and let the system automatically calculate that for me. Again, I want to change that to an acute type of therapy so that it doesn't stay on the medication list indefinitely. If I needed to put in an x-ray, that would be a task charge. So up here I could start to search by CPT for that particular test. If I needed to, say, send this patient to referral, for example, they've had chronic issues with their low back, maybe I need to send them on so I can send a referral request order and specialty. You could send them to orthopedics. If you had a particular provider, you could fill that in by selecting here and completing those details. Reason could be chronic back pain. Okay. And now that I've got those orders in, I'm going to go ahead and hit sign again. Now ordinarily I would go ahead and hit sign, and these would actually fire off to that patient or to that pharmacy for that patient. Since we're dealing with the test patient, I'm actually going to just cancel that, and I'm actually going to go back in and change this to a do not send option so that it doesn't try and actually send these to the pharmacy via e-prescribe. Now when I hit sign, these will go right on through. Now since I came through the note to do my orders, you'll notice that all of those orders show up here in my note. Okay, so at this point I've pretty much finished what I needed on my note as far as documentation. I could of course come in here and click use free text under my impression and plan, and if I needed to jot some additional items such as the plan that we had as far as sending to referral due to the chronic back pain, I could go ahead and type those comments in as well. Once I'm done with my note, I want to go ahead and press sign and submit. You'll notice that the title defaults to low back pain and the type to urgent care note. Low back pain, if you'll recall, was the note template that I chose, and I'm just going to go ahead and sign that. So we've completed our documentation. We have a couple more items to complete before this patient's ready to go. I'm going to go back to the patient's summary, and from there I'm going to click on Visit Summary within the summary component. This takes us to our depart process, whereby we can complete any patient education. So if I click on the pen and paper next to patient education, you'll notice that the education automatically is filtered by the diagnosis that you may have had on your patient. So in my case, I'm going to select an item. I can preview it down here below, and if I'm happy with what this education provides my patient, I can go ahead and elect to sign. The printing aspect will be completed by the PSR when the patient is leaving. So I've signed that onto the chart. I need to go ahead and set up a follow-up instructions. So you can work through this particular module to actually build a follow-up, or you can elect to free text. Okay. If this happens to be a common follow-up set of instructions that I may use, once I have the item down here, I can right-click on that item and add to favorites. That way, in the future, I could come to this item here where it says favorites, and I'm able to select directly from here without having to type those instructions in all the time. But once I've got that set, I can go ahead and sign my follow-up instructions, and then I need to complete my medication reconciliation. This basically allows me to review the patient's medication before the visit on the left-hand side of the screen. The right-hand side of the screen is how my patient's medication list will look at the conclusion of today's visit. So I have 3 meds my patient will be on. I will go ahead and press reconcile and sign, and that signs off on the medication reconciliation. Quick check in the checkbox there for patient education to ensure patient understands what they're given, and then I will sign my visit summary. Again, the printing will be completed by the PSR upon when they're discharged. So now that I've completed those aspects, I'm actually done with this patient's chart, and I could go ahead and close the chart. The last step that I would need to do is back at the tracking board. I need to move my patient from the exam room. So in this case, if this were my patient, I would double click on the room that they're in, and I would put them in discharged and select OK.